So what about the most severe nasolabial folds? What do I do when it's particularly deep? Now this is when a multi-layered approach really helps. So you can actually use all the things we've discussed in the show. I tend to start with a deep treatment. So in the deepest layer on the periosteum, in the piriform fossa, I would do a stabilizing injection that stabilizes the midface in terms of movement, but also just creates a little bit of projection. The next layer up is the fasci layer, where I'd use a cannula to layer some product to create some resistance to the movement and some volume. And then above that, you can use a needle to treat any creases. So you literally go in the dermis and the mid-dermis with a needle and treat the crease. And if it's really bad, you can do a horizontal injection. So at 90 degrees to the actual crease, you layer 3 or 4 injections to resist the movement of the cheek down. And of course, there's the rest of the face to talk about. I know we all like treating cheeks first, and I do recommend that as well. But in terms of just what you do on a nasolabial fold, maybe after you've done the upper face, then I would be doing it in that sequence. And you can also add some botulinum toxin as well if you need to. But typically I would do it in that sequence predominantly with filler because I think it's more effective for the lower face.